Hello. Okay, we're gonna get
Hello.
started in another minute. I just want to make sure everyone's coming in from the main stage. So bear with me. Hello, everyone. Hello, hello. I see people trickling in. Awesome. My name is Alexis De Jesus. I'm the brand marketing manager here at Care Message. We're really excited to have you here today. And just so everyone knows, if you have questions, we are more than happy to answer them at the end of the session. So please make sure you're dropping your questions in the chat. Okay, cool. So if you are here today, you care. And if you are not here but are watching the recording later, we know you care too. This is important because keeping our future generations on track with well child care isn't just about filling the calendar slots. It's about building trust with families and creating healthy habits that last throughout their lifetime. So today, we are incredibly lucky to have two amazing individuals join our panel session today from Midtown Community Health Center and the Health Federation of Philadelphia. So before we dive in, I'm going to allow them to introduce themselves because we are super, super grateful for having them here. And I will pass the mic to Jenny.
All right. Hello. Good morning, everyone. My name is Jenny Bryce. I am the Director of Care Management Programs at the Health Federation of Philadelphia. I'm happy to be here.
Thanks, Jenny. Happy to have you. Hayden, would you like to introduce yourself?
Sure. I'm Hayden Coleman. I'm the Clinical Quality Director at Midtown Community Health Center in Northern Utah.
Awesome. Okay, so we are going to dive in. Hayden, I'm actually going to start with you. What did well child attendance look like on the clinic floor when you started focusing on it?
So like many health centers, we found that keeping children on schedule for preventative care wasn't just a scheduling problem. It reflected a lot of barriers like transportation, changing phone numbers, parents that are juggling multiple jobs, language differences, or simply not realizing when a well child visit is even due. So rather than viewing the missed appointments as patient noncompliance, we looked at the systems that we had in place, workflows, processes, all of that. And we asked ourselves how we can make it easier for families to stay connected. And having just that mindset shift at a leadership level and then trickling down to support staff led us toward a much more proactive outreach strategy.
Yeah, I'm glad you brought up the initial point of transportation because I know Jenny's actually going to touch on that later. So Jenny, I'm actually going to transition over to you. From a network perspective across multiple health centers, what does the well care gap look like and how does Health Federation of Philadelphia support clinics in tackling it?
Yeah. So we do have a very interesting vantage point, being that we work with 7 health centers in our network. And by that 7, some of them could have 3 to 4 sites that are under that umbrella. And so about 30% of our population that we work with, because we do this work for one managed care organization. Every time I make any movement, there's celebration. I don't know if on the screen there's
That could be people like clicking,
that's
like
a
they're all clicking on
oh, okay. I love
celebration is good, right?
um Yeah, and so it's very interesting to kind of see how variations show up in the gaps versus patients that are engaged. So patients that are attributed to that health center by the managed care organization, and also actually, go to that health center for their care, versus patients that are just attributed to that health center, so they're unengaged. Maybe they've never seen a provider there, and so across it can really vary. So we see patients that are engaged and that actually receive other types of care. The well child, the well child visit gap is smaller, and in patients in states where we see that patients are not so engaged and we have to do a little bit more outreach to figure out kind of where are they getting their care, are they getting any care at all, do they know they have a primary provider. We see larger gaps in those areas, and so some of the ways that we provide support is providing some focus for those unengaged patients, because the health centers have enough on their plate. We also provide transportation. We make connections to appointments. We offer support around specialist visits, because sometimes the specialists are far away. And, if a patient's not engaged with the health center, sometimes some of the resources are not yet available to them. So that's just some of the ways.
Thanks for actually touching on that, because the next question is more to dive a little bit deeper into this. So a lot of health centers, do struggle to manage outreach on top of daily clinic things that I don't want to call it chaos, but getting things done in that way that can make things a little bit more seamless. So we know that Health Federation of Philadelphia utilized a centralized care management approach within a network ACO model. So what are the biggest
Mhm.
operational benefits of taking this off individual clinic plates? And how does it drive better well child numbers across a network? I know that was a lot. I can repeat it. So you
Sure.
just let me know.
I think I got it. If I miss anything, we can loop back around. But I mean, the first one off the bat is capacity, right? We have the capacity to focus on just the care gaps and the transition of care, whereas at the health center site, there's lots of competing priorities. There's lots of MCOs that they work with. There's additional programs, there's behavioral health, and so they are focused with the patients that are right in front of them, with the staff that's right in front of them, which makes sense. And so we have the ability to have our team of community health workers um, focus on just these measures. We're able to dedicate the time to do multiple follow-ups if needed. We have the bandwidth. That's another thing, just bandwidth to be able to provide that kind of medium range care. We've had patients that had to have specialist visits that maybe they had a series for dental, and that would be 6 weeks. And so we were able to have a little more flexibility to book those rides for them. Um, and so really it's time, capacity, flexibility that we're able to offer, and also the follow-up. And so we can be a little bit more focused on closing that loop, whereas we're just dealing with less variety of constraints and emergencies. And so that's just some of the ways. And also I think helping the health centers to think outside the box in terms of what the outreach might look like. And I know a little bit later you're going to ask about communication, and I have something to share about that. Um, yeah, and just being able to work around the patient's schedules. So evening hours, early morning, weekends. So we have more availability in that way. And so we're still partnered. We don't work independently outside of the health centers. And so we're just able to be an extension of that support and resource that they offer.
I love that. And Hayden, I saw you kind of nodding your head before while Jenny was talking. So curious to know, how does your clinic team handle the balance between dedicated care management and outreach to day-to-day patient flow?
Yeah, definitely. I'm gonna answer that, but first I wanted to I felt like I was nodding along to everything you were saying, Jenny, and that's because it just speaks to all the health centers that, struggle with everything that we have to focus on, and any support that we get is always amazing. So yeah. But yeah, to answer your question, one of the biggest lessons we've learned at our health center is that our outreach works best when it's shared across the organization rather than owned by one team. We do have dedicated staff. We have health plan coordinators, patient navigators, care coordinators, and a community health worker who do focus on proactive outreach and helping patients overcome barriers to care. But we've built preventative care into our day-to-day clinical workflows. So our medical assistants use pre-visit planning to identify care gaps before the patient even arrives. Providers try to reinforce preventative care during visits, like acute visits. And our outreach teams use population health registries and care message to reconnect patients who are overdue. So our frontline clinical staff can stay focused on today's patients while our outreach teams are proactively working on tomorrow's schedule. And technology has been a huge part of making that balance sustainable. So automating routine reminders and recall campaigns through care message reduces a lot of that manual work. It allows our staff to spend more time on patients who need that personalized follow-up and may have more complex social or medical needs. So it really becomes a team-based approach where everyone has a role, but no single group carries the entire burden.
I actually really like this model. I feel like a lot of the conversations that we have, there are dedicated folks to take care of these things, but the fact that you're making it a team-based
Mm.
approach is extremely awesome. Like I love to hear that. And also thank you for the shameless plug for Care Message. Appreciate it. Yeah, if there's any other ways for anyone in the chat that has questions on maybe how to make things run a little smoother, like we can definitely help out. We have a great team that helps and assists for that. But moving on. Jenny, this question is for you. Health plans and Medicaid managed care organizations often have incredible resources for families, transportation vouchers, incentives, wellness rewards, but clinics rarely have time to promote them. And I know this was a conversation that we had yesterday or the day before. I can't remember, but you were kind of mentioning this. So, how can networks and clinics better bridge that gap and leverage insurance resources to get children in the door?
Yeah, this is one of the things that we really wanted to focus on this year in our contract because so So let's talk about incentives first. So that is the cash incentives that all, I think most, if not all, payers do offer. However, the feedback that we receive from our health centers is that they don't want to feel responsible. Patients sometimes get confused about what's going to happen at the end of the visit, and they expect that gift card at the end of, they get their blood pressure check, here's your gift card. And so it doesn't quite work like that. There is a process. And so there is administrative burden that could fall on the health center in the promotion of that. And so kind of understanding that it's not necessarily that either they don't know or they don't want to share it. It's just being mindful of what they're able to communicate and who's going to handle that and XYZ. So one of the things that we've been able to offer and provide support around is us doing the communication when we do our transition of care. If we notice that gaps are being filled, but trying to find ways to connect the patient directly to that resource and not necessarily pulling in the provider. So educating the patient on what they're leaving on the table. I mean, for the payer that we support, $50 for well child visits, $75 for breast cancer screening. That's not nothing in today's economy. And so educating them about how to obtain that is really invaluable. There's other resources that are often left on the table, gym memberships. And I mean like flexible gym memberships where there's a pass, they can go to any gym that's available. There's training. If you have a caregiver, the caregiver can also um, be part of the gym. And so when we think about these types of resources, just outside of the gym, I'm thinking of folks who maybe have unstable housing. That's a place that's you're allowed to be in, that there's air conditioning, right? That you could potentially get a shower, that you might be able to get a locker where you actually are allowed to be there. We do have a population cohort that of folks that are housing is either unstable or or unhoused or transient. And so we think about, you know, the adolescents that perhaps are wanting to try out for football in the fall. And so we're thinking about the patient as a whole, like what things matter to them right now, and how can we attach them or connect them to resources that exist within the payers ecosystem, because there's so many, prenatal programs where you can get free car seats, and so the thing is there's a lot of duplication in some of these efforts. I know the health centers are often they're connected with other partners, but the advertising and the marketing sometimes for the MCO resources can be a bit lacking. And so we've been working with that particular payer to advertise a little bit more, get one pagers, and just kind of get the word out, and then try to make it easier for the patients to actually access these. So, it's nice if it's there, but if they give up or get demotivated because it's a long process to apply or to enroll, then it's not worth it. I hope that answered the question.
It does, it does. And I saw Hayden I saw you nodding your head again. Did you want to add anything in there?
No, nothing to add. I live these things, so it feels
Yeah.
very applicable, relatable, and accurate. So yeah.
Yes. Hayden, I'm cheating a little bit because my background is I've worked in FQHCs. I was operations director for an FQHC, so like I've also lived it, and so I think
Yeah.
being able to bring some of that experience, like, well, this is what it's actually like on the
Yeah.
ground, is helpful. And
That's awesome.
Yeah, and since you both, I guess, have that experience, right, from a direct patient standpoint, Hayden, what incentives or resources actually motivate parents to schedule and keep those well child visits?
So we have found that convenience, trust, and clear communication are very strong motivators, um, possibly more so than incentives alone. We definitely have offered incentives in the past through the use of, we actually have what we call our teddy bear den. It's this closet that we have that offers free like infant care items to parents. These are brand new items. They're not like donated or like lightly used. These are brand new items that they can come in and receive by the way of like a coupon system that we have. So for parents who attend the well child check appointments, they can get one of those coupons and they can come to our teddy bear den. We also offer that through our prenatal care appointments. So we have kind of that combination of the motivators and incentives. But generally, we know that parents want to do what's best for their children, but life is busy. Preventative care easily falls behind work, school, and just family responsibilities. So we try to focus on making it as easy as possible to access care, and that means offering convenient scheduling, sending timely text reminders, communicating in the family's preferred language, and explaining why the visit is important, not just that it's due. So we always try to tie the appointment reminder with some care gap, that is important for like the preventative visits. So that parents are much more likely to schedule when they understand that the well child visits are about tracking development or staying up to date with immunizations, addressing concerns early, or keeping their child healthy for school and everyday life. All of those kind of messages that we tweaked that based on kind of the school year priorities and things like that. So we also work to reduce barriers by connecting families with transportation resources or insurance enrollment assistance that we have in-house, interpretation services, and then other community resources by way of our one community health worker. Sometimes removing a practical obstacle is the biggest incentive that we can provide. So we believe that relationship with the care team is one of the strongest motivators as well. When families know that when families know their provider, feel respected, and trust that the visit will be valuable, we've found that they're much more likely to return year after year. And our goal isn't just to fill appointment slots, it's building long-term relationships and keeping these children engaged in preventative care throughout their lives. And we have many families that have been here since they were born, and it's awesome to see the growth and expansion in their families.
Yeah, that's great to hear about your retention rate. I did have a question about something that you said earlier. You said something about like a couponing system. Was that created in house, or do you partner with other people on that? Like, how does that work?
So that was something we created on our own. The teddy bear den is um, it's available through donations again of brand new items. But that's just something that we have here at one of our main sites. We have 6 clinics in northern Utah. And so if a patient attends any of the like prenatal care appointments or well child check appointments outside of our main site, they just grab that coupon from wherever they saw that provider, and then they come to our main site and we can open that. It's a closet, but it has a lot of cool stuff in there.
Yeah, no, it works. That's actually really cool. I hope that some of the clinics that are attending today, they don't already have that. Maybe they can take that idea. But no, that's awesome. And you already kind of touched on this before, but we're gonna dive into a little bit more. So, what's the single biggest reason, or if there's not like a single big reason, but a couple reasons of why families miss or skip well child care visits in your Utah clinics? And what data informed or tech enabled approach genuinely moved the needle, and what flopped, like what did not work?
Sure. I say the biggest barrier is again those competing priorities. So many of our families are balancing work, childcare, transportation, housing concerns, and other just basic needs. So healthcare, what we've experienced, can unintentionally move lower on that list. So instead of relying on families to remember appointments, we've built workflows that bring preventative care to the forefront. We have automated outreach. We also segment a lot of our campaigns so that messages are relevant and timely rather than just generic reminders. Our care teams also connect families with resources, again, like that transportation assistance, insurance, enrollment, and interpretation. And then being able to address those social needs alongside scheduling has made a meaningful difference. Um, I think our biggest improvement came from moving away from a broad approach and moving more towards a targeted approach. So instead of sending the same reminder to everybody, we use a population health management or data tool to identify children who are actually due or overdue for their well child visits. And then we automate those campaigns while personalizing them by language and care gap or care need. And all of that we can kind of segment through our population health management tool. So one thing we've learned that doesn't work well is sending too many reminders without a clear call to action. So families become like very desensitized if every message looks the same. And we've found that having fewer, more purposeful messages with easy scheduling options perform infinitely better.
Mhm.
Yeah, no, that the targeted approach definitely makes sense. And Jenny, I think did I just hear you say mm-hmm?
Mhm.
Did you have anything to add to that?
Yes, I mean, I co-sign everything Hayden said. I think just kind of humanizing the outreach really makes a difference, and then giving people a chance to say yes or no. Um, yeah, and one of the things we found, I think Hayden already touched on this on convenience, but also to whatever extent possible, identifying like if there's other children in the family, so that way we can, a lot of clinics do this and they maybe don't share that, but like, hey, you've got 3 kids, they fall into this age group, try to make appointments for the family. So that tailored approach is going to win every single time. Like people want to feel like they're talking to a human being and that we understand some of the context that they exist in. So I second everything she said.
Yeah,
Awesome.
I'm glad you brought up the siblings or like bigger families because we actually built like a call out for that into our scheduling rules um, for sibling scheduling. So that's like forever in our policies and procedures.
Yeah.
Cool. Jenny, this question is for you. So, across your network, what trends are you seeing? What are you seeing in how modern tech or texting helps bridge language and access barriers?
Yeah, we do use a language line. So if we identify off the bat that the patient speaks a different language, we'll just have the interpreter on the line at onset. And so there's already that sense of comfort where we say hello. And a lot of our SHWs have a secondary language as well. So that does help. Also, texting over calling is definitely has been increasing in trend. And I think also, yeah, just that kind of curating communication that is human centered. Um, there's not really like a hack or a tip and trick. It's really, you do have to do the work to humanize the communication, even if it is going out in a mass, if it's mass communication. Um, and also giving people a way to respond back. Like I know some messages will just be like, do not reply to this. Like that doesn't go over well at all. People are still going to reply. Yeah, and then I also think giving folks an opportunity to say if you want to talk to someone, like we can call, is it okay to call you? So some folks, what we found, like literacy could be low. We haven't gotten into this market yet, but we would like to explore kind of, what would some audio look like instead of texting, because we are coming across a lot of literacy issues and just low literacy in general. And so could a voice note, be appropriate in some at some level. So I don't know if you have any experience with that, Hayden. But yeah, it's just we need to kind of just keep abreast of how our population is changing, our aging population now, and versus our, some of the teens that are going to ER for things that they can go to health centers for, and how do we communicate with them? So we're always looking at our population, segmenting, like Hayden said, to understand, okay, what's happening in their life right now? What are the needs? What is the best way to connect? And also trying to find organic ways, like what do they care about already? Because they're not going to know. First of all, care gaps don't exist in the real world. Like that's not a thing that people think about or talk about. And so if you can't integrate it into something that they are already wanting or needing, or maybe identifying a need that they don't know they have, so in that way, this is where the social marketing element of it for all my public health folks comes into play, where we need to use some of those advertising tactics to um, kind of speak to folks and kind of speak to some of the needs that we know exist, and they're just looking for someone to kind of articulate it, or to create some resonance, so they can say, actually, yeah, like it is my birthday, maybe I would like to have a full checkup, or my birthday's coming up. So just again, humanizing it and being intentional.
Yeah, thank you for sharing. And I think Hayden and Jenny had asked, like, are you testing out anything with voice notes or anything like that?
Oh, yeah. No, I thought that was a very interesting call out. I think there's definitely that gap right now where we have voicemails that go out or like voice calls and then texts that go out, but there's tons of people that don't even listen to their voicemails and then or they like just completely disregard voicemails entirely and don't want to be on the phone. And then with text, yeah, I think there is this opportunity to definitely build like programming and tech around having those messages read. I have experienced a lot, not a lot, a handful of patients that have apps that do that for them. But that's like an additional thing that we kind of
Mm,
have to like educate patients on and say this is an option that kind of integrates into your phone and it will read off things for you, or like instead of getting an alert that you have a message, it'll just read the message. So
mm.
those things do exist, but they're not intuitive, I don't think, or really common. So I thought that was very interesting.
Yeah, I think voice note approach is actually really cool and something I'd like to think about more and how we can help clinics
Mm,
do that. And then the other thing, like you mentioned, Hayden, like so many calls in a day. There's so many spam callers. So like I can only imagine like how many people are getting all these spam calls and then the important voicemails or voice messages that actually need to be heard, whether it's, appointment reminders or upcoming things to like know or whatever the case, right? Follow-ups. Those are getting lost. So I'm glad that you called that out and hopefully there's a
mhm.
way in the future we can fix that somehow. um, for this question is actually for both of you. And we'll start with Hayden. So there's a fine line between a helpful reminder and a family being or feeling overwhelmed or nagged. How do you find the right rhythm and messaging tone so that parents feel supported rather than spammed, especially when families are navigating, unstable phone numbers, how you mentioned, they're changing phone numbers, shifting life circumstances, and etc.
Yeah, so we try to make every message valuable. And I mean, there's no single solution to, the changing phone numbers or like things that kind of are out of our control. But instead of sending frequent reminders just because we can, and we certainly could, we focus on sending the right message at the right time. So messages are concise, personalized whenever possible, and I think the most important piece that we've incorporated is including an easy next step. So I've actually moved away from including like call this number to schedule, like having that be the call to action. I moved more towards like reply A if you would like
Mm,
to receive a call to schedule. So having that intent for the patient saying, yes, I want somebody to reach out to me to schedule, or no, I don't. Also just helps guide our work. But so we're more able to closely monitor engagement rates and then adjust our campaigns if we notice that response rates are declining for whatever the reason may be. Um,
yeah.
I love that. Like I keep hearing you say concise and so like it's funny because like clear, concise, and convenient is my daily motto. So I can only imagine it actually being necessary for like our patients that are entering these clinics. And Jenny, I know you I think I just interrupted, but feel free to add on to that.
No, I agree. I don't know if there's a formula. I mean, sometimes we know it's too much when we get blocked. And so I think one of the, which doesn't happen often, I think one of the benefits that come with having a centralized navigation is that we it's okay if we get blocked, right? So we do some messaging on behalf of the health center, so that way it's not so much it's not condensed all this stuff coming from them. Like we can take a little bit of that heat. And like Hayden said, we want to be intentional about the communication and also not put additional burden on folks. So yeah, saying we'll call you, we'll take care of it. Additionally, there was something that you said, Hayden, that made me how much is too much? Nagging. Um, acceptance. I think we have come to there's a level of acceptance that you have to have that's just we're not going to get everyone, and there's just going to have to be other models. And I think one of the things the health centers do well, and that maybe doesn't get enough credit, is like when people come in for because they're going to come in for something. And so then doing like if there's an emergency, or if they come in for urgent care, so being able to see or have your population health information let you know, like, oh, there's a care gap missing here. You can transition this sick visit into a well child visit, right? You can transition this med check visit into a well child visit. So I think those opportunities also exist. And again, I think just kind of coupling it with other things that are timely and make sense, and just keeping it, like you said, concise. Um, so yeah.
Yeah, I totally agree. And Jenny, we'll keep the ball rolling with you. So for show up rates are easy to count, and but they don't tell the whole story. So behind simple attendance, how do you measure if the well child programs in the 7 clinics that you're helping are actually working, like catching up on childhood immunizations or developmental screenings?
Mm. It's always how do I say, there well, the numbers, we look at the data, but we also look at the patient experience, and we look at how workflows have evolved to be able to capture those patients that are needing well child visits. And so again, we segment our patients versus like the engaged patients versus the unengaged patients, because their behavior is very different. And so for a patient that's never been to the health center, doesn't have any connection to the provider, I think it's unfair to kind of have an expectation that all these measures are going to be met. And so as far as that, we don't beat people over the head with the data of it all, because ultimately the issue is there are there enough pediatric providers? Are there hours available for evening appointments? So we work excuse me, we work with each health center to understand their specific um, barriers, or things that are going well, to kind of paint a picture. So like we don't get too stuck on the numbers. But I will say overall, patients that are engaged, gaps are being closed for the most part. And then the patients that are unengaged, we do have the ability to connect with them a little bit more differently and a little bit more intentionally, to understand their patterns and behaviors, and maybe get them reassigned to a different health center, so that way it's not coming back on the attributed health center for them to have that responsibility. So I hope that answered the question. We like to look at things holistically.
It does, it does. No, and I like the fact that
Mhm.
you mentioned like the behavioral patterns and everything, that you're looking into everything across the board. So, Hayden, same question for you. So like how do you measure if well child programs are actually working, like catching up on childhood immunizations or developmental screenings, or both?
Yeah, so I mean, we do track attendance. I mean, we have our no-show rates and all the like scheduling measures that we definitely look at, but we try to pay even closer attention to the outcomes. So those care gaps that Jenny mentioned, we monitor whether children are receiving recommended immunizations, and there's I mean, if everyone here is from an FQHC, we have our like HRSA, UDS things that we're accountable for
Mhm.
reporting on. So those immunization measures, developmental screenings. I know like HRSA added a couple new measures to like track for developmental screenings this year. We track our lead screenings whenever appropriate, and just all of those other preventative services that can occur during those visits. And we also look at the overall preventative care completion rates across the like specific pediatric population. So success isn't simply getting a child into our clinic. It's making sure that while they're here, we're trying to be as comprehensive with their preventative care as we can. We know that there's this struggle and this fine line between being all things for all people and doing all things for all people, and then our capacity and our ability and burnout rates are that's a real thing. And so just having that balance of while we have patients in our clinics, kind of remembering that we are trying to be as comprehensive with them while we have them here as we can, because unfortunately we do know like we don't know when the next time is we may see them. So
Mhm. And if I wanted to add also, we do have a population health platform that we use, and the benefit of that, we can see comparatively how folks are doing. So, and we have a community, an HCCN community, so folks don't feel so isolated or feel like they're doing well. They're doing so much worse than everybody else. I think sometimes when you can't see the data, you can't have that kind of um, overview, it's hard to know if you're having effect, if you're having any impact. And so I think most times people are hopefully more pleasantly surprised, like, oh, okay, yes, this outreach is working or this new workflow is working. And so we're able to look at um, I think we have about 30 plus health centers within the HCCN. And so we can kind of track and see overall how folks are doing. And they also meet regularly to talk about what they've implemented, what's working well, what's not. So the benefit of having the community of the health center, so we can look at the quantitative data as well, but also connect it to what changed. Because, last quarter it was this, and then you implemented that, and like 2 quarters later, you're here. So that community component is helpful.
That's amazing. And before we go to our last like our takeaway question, right? We have one question that came through, and then someone in the chat mentioned Health Alliance for the uninsured. Vicky, I'm not sure if there was a question behind that or if you were just adding that as an additional resource, but please let us know. But we have a question from Erin House. She's one of our amazing partners at Prime Care Health. We love you, Erin. So she had a question for the both of you. How do you define engaged or not engaged patients, especially with children or under the age of 2, since they need more visits? That's the first question. There's actually like 2 questions. Um, do you have tiers or different messaging strategies? Because they struggle with patients that come in at the newborn visit, but then lose them, or older kids that only come in when sick. So I think Hayden, we'll start with you on answering that. I can repeat it if you need me to repeat it as well.
no, that's okay. So I that's definitely a challenge that we face. So during those first 2 years of life, when there's so many recommended well child visits, we try not to think of engagement as simply active or inactive. It's really a continuum. So we use age and care gaps. We really use age and care gaps to drive our outreach. For infants and toddlers under age 2, we consider them a slightly higher priority population because even missing even one well child visit in that age range can mean delayed immunizations or developmental screenings, like missed, diagnoses and opportunities. So those children definitely do receive more frequent, timely reminders that align with, that recommended well child schedule. For older children, our messaging does change. If they're generally healthy but overdue for an annual well child visit, our outreach focuses on preventative care, sports physicals,
Mhm.
school requirements, and then just making sure those immunizations stay up to date. And so we try to make the message relevant to where that child is in life. One group that we're paying particular attention to is it's what you mentioned, families who come for newborn visits and then disappear. So rather than waiting until they're 6 or 12 months overdue, we're looking at earlier outreach after that first visit. If a family misses the next recommended appointment, we want to reconnect quickly while we're still trying to build that relationship, because they came to us once and we haven't really had that opportunity. So we also look at utilization patterns. If a child is only coming in to our urgent care or only being seen for sick visits, that's a kind of a flag, like an opportunity for us. During those visits, our care teams check whether they're overdue for preventative care. I think one of you mentioned this. So like using those urgent care visits or sick visits and kind of turning them into preventative care visits whenever possible. And then and part of our workflows is making sure we're scheduling that next appointment before families leave the clinic. I don't think there's like a perfect outreach cadence. I just think the biggest opportunity is using whatever data you have or access to data that you have to identify where children are falling off the schedule, and then tailoring communication based on age, risk, visit history, instead of sending the same message out to everybody. I hope that answered some of that question.
I think it did. And then Jenny, did you want to add anything to that?
No, I think Hayden covered it. I mean, since she's on the ground, I think just from our perspective, it's really like a criteria thing. Whereas has the patient been to that health center within the past 2 years, they're engaged. If they haven't, if they have a EHR record, so that's how we come across folks in our transition of care work that we do. So we don't necessarily utilize that language with them. But it's really about how much information do we have on this patient and what's been going on with them for a period of time. And we don't, our measures as far as 0 to 2 is really, is the lead measure is what we focus on. And so with those patients, we do a little bit more intentional outreach. Like we will make the call, we will talk to the parent, we will offer other resources. But again, the health centers do the majority of that heavy lifting because it is such a very delicate time. And so our focus is on the mid range.
Appreciate the response. So we are down to the last couple minutes. And thank you so much for those that are here and asking questions or just listening. And I hope you guys can or hope everyone here can take something away. So last thing for you both, for the health centers watching today, what's one thing that they can change when they engage with parents? Like what's the most actionable place to start? So we'll start with you, Jenny.
Engaging with parents. I mean, I cannot overstate the human connection. I know we're getting into AI and all this remote stuff and all of that. And the goal of AI is to maybe take some of that burden of the tech stuff and maybe the built-in assistance and organizing. But as far as care is concerned, a personal touch and connection and intentionality is always going to be the way to go. So I think just thoughtfulness, being present with your patient, and having patients that come for generations, that's the result of genuine care and connection. So I feel like as the more technology grows, the more the desire for that human engagement is going to grow. So finding ways to humanize your efforts and also training your navigators to when they're doing their outreach calls that they're not engaging with the patients as a care gap in like someone on a care gap list, but as someone that has a whole world, and finding little ways to integrate that.
Thank you. I appreciate that. And I do agree with the human connection part.
Mhm.
Hayden?
Yeah, I mean, I'm pretty much echoing everything Jenny said. I would encourage clinics to stop thinking about outreach as simply sending a reminder and start thinking about it as that relationship building, which is part of that human connection, right? Use your data to identify who truly needs outreach, personalize that communication, and then make scheduling easy. Don't assume a missed appointment means someone doesn't care. Like separate the frustration with what that's doing to your no-show rates or your, whatever scheduling metric you're looking at, and kind of just consider it more like, okay, it often means life got in the way for that patient or that family. So when you combine that thoughtful technology with compassionate care teams, you will see the improvement in preventative care, while also simultaneously just strengthening the trust that you have with your families that you're here to serve.
Yeah, I appreciate you saying that about the parents. We actually have a session coming up later on about like what parents are actually thinking, because our one of our her name is Rhea, and she's a researcher. She's a senior researcher, a senior user researcher. She's amazing, but she actually has these conversations with parents on like why they're missing certain things or what can be done to help. So I hope everyone tunes into that a little bit later. So that is the end of our session. I appreciate you both. Thank you so, so much. I will be in touch with you afterwards. You two are the best. And if anyone has any questions, please feel free to drop them. We can always send them afterwards via email. And we'll be covering a lot of things that were spoken about we always have a website it's filled with our recap and our notes. And we'll also be sending out a newsletter too. So Hayden and Jenny, thank you both so much. I appreciate you both. And I will see you soon. I will talk to you soon. Everyone, I'm going to send out an announcement. You can head over to the next session, which is Overcoming Vaccine Hesitancy at the Point of Care with Dr. Ilan Shapiro. So see you all there. And thank you again.
All right.